Welcome to this series of talks on health and justice with a particular focus on socioeconomic determinants of health. So my name is Angus Dawson. I'm a professor of bioethics here at the Centre for Biomedical Ethics at the National University of Singapore. The objectives for this series are to explore and allow you to understand more about the concept of socio-determinants of health and the contribution that they play in relation to thinking about health. And that's related to both individuals and communities. I have a particular focus on thinking about the ethical values and explaining how ideas about ethics can be used to inform health policy. And I will end by looking at some ideas about what the implications are for thinking about designing healthcare systems and particularly the role of public health. So the module structure is that there are 4 different videos. This one is the introduction. The second one, I will look in more detail about what we mean about socioeconomic determinants of health and broader contextual structural factors in more general terms. Video 3 will look at some of the ethical concepts that are used in these discussions, and video 4 we will look at what the implications are for our health systems, particularly thinking about public health. So I think it's common when we think about health to always think about individuals. And this is partly because of the idea coming from medical ethics, clinical ethics, more generally, the focus on the relationship between a healthcare professional and an individual patient. And there's also a metaphysical aspect to this in terms of thinking about how it is an individual that has a particular kind of disease. If you have dengue, it's you that has dengue. So you will be tested and treatment will ensure in relation to you as an individual. This also links to ideas about responsibility, which is one of the key ideas behind a lot of the issues that we'll be talking about. For example, we can think about how with many chronic diseases, we tend to assume responsibility for the individuals for creating the conditions for that particular chronic disease. And what I want to suggest in this course is that at best this is far too simplistic a picture. So just to explore some of the reasons why there might be this view of agency that is dominating our thinking, or is the immediate set of assumptions that we have when we think about these questions. It is largely due to a whole series of factors that push in the same direction. So we tend to have this idea about a self as being at the heart of agency, and that self has an identity that persists over time. Again, that sort of idea has been contested by many different philosophical traditions. That then links up with thinking about rationality. For example, ideas about the assumptions that dominate in much classical economics, that we are as human beings rational deliberators. And that links up then with thinking about what we believe in relation to various kind of key ethical ideas, such as assumptions about autonomy, that we are the individuals that we are, that we have the control that we do, and that we should have respect for the kinds of decisions that we make as individuals. So these kinds of ideas about agency are things that you can see reflected in the everyday social, legal and political conventions that support this idea of you being the individual that you are. And it's natural, given all of this background, to assume that health is something that is within your individual control. The idea about choice is key here as well. Clearly we have a great deal of ability to make choices that can impact upon our health. But part of the focus for these series of talks is to explore the degree to which we actually are completely in control of the factors that impact our health. And you can see a number of reasons why we might question the degree to which we are actually completely in control here. So for example, we have a genetic makeup which we don't have any choice over, we're just given that. There's epigenetic considerations that again it's disputed to what degree these influence the way that we are, but if they exist, to the degree that they exist, they are going to be shaping things that are beyond our control. And certain kinds of cultural factors as well are going to shape how we are as individuals, and again, they are beyond our control. But the real kind of key issue for us in this series of talks is thinking about the place of the socioeconomic determinants and the influence that they have over our health states. So one reason why we think about individuals and their ability to control their health status, the choices that they make and the impact that they have upon health status, is because we have a set of assumptions about more ethical and political ideas, particularly that of responsibility. So it's very common to assume that responsibility for your health status is something that is an absolute key when we are thinking about health policy and the construction of healthcare systems. And this is something that we'll come back to in the fourth lecture. So moral responsibility here is often taken to be just tracking the causal responsibility. And again, what I want to do is to raise some questions about the degree to which that is true. The more elements that there are that impact upon your individual health that are not under control, the more we might argue that it's unfair to actually just assume that all moral responsibility is attributed to you as an individual. So one of the things that I would like you to think about when we work through the issues in this series is the degree to which we are causally responsible, and therefore that we are morally responsible for our particular health outcomes or our health states. So what I've tried to do in this first introductory lecture is to raise these series of questions about the degree to which our common assumptions about individuality, what it is to be the person that you are, to have control over the actual health status of you as an individual, and how that relates to thinking about these other factors that are impacting upon your health, and what the implications are when we start thinking about maybe the role of these other factors that are not so much within your control. The degree to which you and your health states are shaped by other factors beyond your control, the more we can ask some questions about the fairness of actually assuming that you are completely in control in relation to your health states. So thank you, I'll stop there.